I left it. We had 8. I think we have 10 on board. Well, it's 1:06, so let's get started. I want to welcome everyone to the Utah State Board of Education's special meeting, May 28th, 2020. Our agenda, Jeff, thank you for running the screen. Before we get started, I kind of want to do a roll call. Well, I'll just call out who I see in here. There's Mark Huntsman, Board Member or Vice Chair Brittany Cummins, Board Member Earl, Board Member Hanson, Board Member Gravitt, Board Member Belknap, Board Member Lear, Board Member Cannon, Board Member Newell, Board Member Haynes, Board Member Marsh. And as others come on, I'll Vice Chair Brittany Cummins, if you see him and I don't, let me know and we'll recognize them to the public that's listening and not getting to see what we get to see. Okay, I could do a roll call, but then that means people will be unmuting their mics and then muting them again. So do you think I've acknowledged them well enough, Vice Chair Cummins?
Yes, I think so.
Okay, thank you.
Can I just remind board members to mute their mics? So Board Member Cannon, Board Member Haynes, if you don't mind hitting your mute button. Thank you.
Okay, let's get started. The first item of business that we have under number 2 on our agenda is the general consent calendar. At this time, board members, is there any items that board members wish to be pulled off the general consent? I'm not seeing any hands raised. I'm seeking a motion.
Mr. Chairman, I move that we accept that agenda written and presented.
So we have a motion to approve the general consent calendar by board member Marsh. Is there a second?
This is board member Newell. I'll second.
Thank you, board member Newell. Any discussion? I am not seeing any hands raised. So board members, if you would please vote as we've been doing. That the green check is a yes and the X is a no. And we have a hand raised on board member there. Okay, that'd be a yes. Marsh. It appears the voting is unanimous. Is that how you see it, Vice Chair Cummins?
Yes.
Okay, the voting is unanimous, so the motion passes. Thank you. Next, we would like to invite Utah Schools for Deaf and Blind Superintendent Joe Coleman. And if you have other staff that you want to introduce during this your presentation, that would be good. This is a information item. I'll turn the time over to Superintendent Coleman.
Thank you. Can you hear me?
Yes.
Okay, great. We also have Carl Empey on the line with us. Carl and I have been working closely with the LFAs for several weeks now. And after the board adopted its list of budget cut recommendations last week, I realized, you know what, we probably should have been communicating better with it before that conversation, although we're very supportive. And we're grateful that you put our cuts on the 10%. We've been going through just with a pick and shovel every single aspect of our whole organization and looking at what we would do, of course, in worst case scenarios. So we thought today that it would be a good idea to just answer any questions you had. The USDB cuts were made to the board's overall budget if it gets to a 10% cut, and it came out to a total of $1.6 million roughly, and that would represent about a 5% overall cut for us. Most of that, or a large portion of that, can be done by probably about a third of that, I think, would be done by reducing our operational budget without affecting personnel. It would be taken from each of the unit budgets, and what they would do is just cut back to bare bones on what they had to do and not do some activities and other things, reducing travel, eliminating 2/3 of the out-of-state travel, if not all of it. And also, then on top of that, we would have, to make that 1.6 million, we would probably have up to around 10 positions that we would have to consolidate or eliminate. And it depends on the positions, of course. An aide position would not be as much budget savings as a full-time educator, for example. But we would look at where to make those cuts so that it would have the minimal impact possible on students. Also, something you should know that as we look through all of this, of course, we don't really know where it's going to come out in the end. But whenever we have to do that, we're essentially doing this and prioritizing by, number one, the effect on children. Number two, our legal liabilities. Everything that we do and all of our staffing is directly related to compliance with federal law and state law. Of course, IDEA is the federal special ed law, and the state law being our instructions through the state legislature on what the expectations are of USDB to serve the children in the state. And then in addition to that, there are your administrative rules, which are given to us by the board, which create additional clarification for our obligations. And so in that descending order from board rule to state law to federal law, we would look at compliance challenges. So for example, if we had to eliminate a position, we would prefer to eliminate a position where board rule requires us to serve a school district at no charge, rather than the state law that requires us to serve a child ourselves on our campus, or federal law requires us to comply with special education regulations. So we just wanted you to know that we looked at everything through that lens, and that's if we end up having to make any cuts, those would be the way we evaluate what we do and how we do that. So that's just my introduction, and I wanted to let you know kind of what we were thinking on our end, since you're our board and we take our instructions from you. And so I'm happy to answer questions and help you understand anything more if you have any additional questions.
Chair, it appears that Board Member Belknap has a question. And I just wanted to add that Board Member Davis and Bolter have joined our meeting since the roll call.
Okay. Hey, thank you. So can I be heard? Am I still on? Okay. Shows that I am. So to kind of sum this up, the 2% that was that we were working on with the legislature. The 2% could be dealt with operationally, as you described, with out-of-state travel and some other things, operational things that you can come back on without having to cut programs and employees.
Right.
The 5% that you're talking about is about cutting employees, with your strategy being to obey federal and state requirements first, and then come to us on anything that we would have in board rule, and ask us to waive that rule and or change something within our board rule, and you would most likely come really close to the 5% that might be getting into the compliance side on state law and some federal, and the 10% definitely would cut into federal and state law. Did I sum that up correctly?
Yeah, 10%. So at the a 5% cut for us would be probably something around 10 positions. We could still comply with federal and state law, and probably board rule. Be really close. If we needed to tweak it or something, we could. But I think we could even do that within our infrastructure now. But if it got to the 10% cut for us, that would be more like 25 positions, and we would have to get we'd have to have a discussion with the board at that time about adjusting board rules and maybe having some allowances with the law, but probably just board rule at that point as well. We don't have an option of not complying with federal law. It's just what it is.
And our legislature.
What this means in a real pragmatic way, what I mean by this is we might cut services to other school districts before we would cut services to our students on their own campuses, because they are responsible for the IEPs in their school districts.
Yes. And then before I take all these questions, can you speak to the enrichment funds?
The enrichment funds are unaffected. So our summer camps and other things that are approved on that, our deaf mentoring services and so forth, they would be unaffected because that money comes from our land trust and it's not appropriated by the legislature. Keep in mind, all of this also does not include the 7 new positions that we were given this year by the legislature, which we were going to expand, to cover the actual needs of the kids in the state by that many FTEs. So we aren't even talking about those. So if we're cutting 10 positions, we're really going to be down 17 from what the overall state needs are. But it's the crisis that we're in, and we understand that. I just want you to have the full picture there.
Okay, thank you. Board member questions or comments? Board member Belknap? And I think there's some of you board members still have checks by your names.
I took my hand down, Chair. You asked my question.
Oh, okay. Any other questions or comments? We're looking in here, and visiting with the superintendent, we thought it would be best to get on our earliest agenda and just make sure the public and the board is informed of the what ifs that's happening with USDB. Is there comments? Are you seeing any of their hands? I am not.
No.
So Superintendent, thank you for your report, and Carl for your work on this. As this plays out with the legislature and stuff, we will definitely be talking more about Utah Schools for Deaf and Blind and the budget challenges, and we'll be discussing how we're going to react to that, Superintendent. So thanks again for your report.
You're welcome. And if any board members start having questions subsequently, don't hesitate to reach out to me individually for information. I'd be happy to get into the weeds as much or as little as you want to. And the other thing I wanted to mention before we sign off is that our graduation is coming up on the 4th of June, and it should be quite fun. And we will make sure to send you a link so you can observe. We are going to be able to hold it in person here with appropriate social distancing in our gym on the Salt Lake campus. And so we're really excited for that, to at least have a human wrap up to the strange year.
Okay. Thank you, Superintendent, and please share our appreciation for the work that you and your staff is performing. And we know this is a challenging time for our deaf and blind students, so thank you.
Thank you. We appreciate that. Have a good day.
All right. Take care. Be safe. Next, we'll go to the superintendent's report. Superintendent Dixon, are you?
Chair Huntsman, may I interrupt?
Yes.
This is Board Member Haynes. I'm getting text messages that people watching our YouTube channel that there is no volume, that they cannot hear any sound. Could somebody look into that?
Absolutely. We are on that. Miss Lorraine, can you please coordinate with Jerry on that if he didn't hear the message? Thank you.
Yes.
Okay, thank you, Miss Lorraine. Okay, Superintendent Dixon, Superintendent's report.
Good afternoon, everybody. Good to see you all. Can you hear me?
Yep, good to see and hear you.
Great. So yesterday we had an exciting public approach meeting. So just to give a little bit of a summary, the committee, the Public Health Approach Committee, got through 2%. So they were not able to get through the other list, but we just got notice right before coming on this meeting that there will be a June 1st meeting. I believe it starts at 9 o'clock and will go until noon. And it's also my understanding that the chairs will have a little bit different strategy moving forward so that they can hopefully get through the rest of the agenda. We were given an assignment to work with the software companies that we have contracts with to see if they would be willing to come down and reduce their cost in accordance with possible budget cuts, and then agree to statewide pricing where the funding would go directly to the LEAs and they then would make some choices about the software that they use. So you might recall that one of our grants is a qualifying grant, and that's in the literacy software space. And then we have another one for ELL that's a competitive grant. So there are a variety of the ways that those contracts are set up, and Zach Christensen and his staff will be working on that task over the next week or so. So I don't know that we'll be ready with that information in a couple of days. It's quite an arduous task, but we'll work on the task we were given. The next item that I want to discuss is our ESSER funds. As you know, we sent in our application, we were approved right away, and all of the funding has been loaded into the grants management system. So far, we've had 16 applications from our LEAs turned in. 8 of those were approved, and then 8 just had a few little minor tweaks that needed to be redone in order to qualify. So those will come back in, and we can start sending out reimbursements as early as next week. So it's been a really good, quick turnaround process for our schools to be able to get the funding. I would just bring to your awareness some of our smaller LEAs, especially some of our smaller charters. The reimbursement part is a struggle for them if they have to have money up front to make a purchase and then get reimbursed. So that's something that I think we need to be aware of and continue to work on to see if there is a way for some of these smaller LEAs to make sure that they're getting their needs met and then a quick reimbursement. The GEAR funding is the governor's funding, and you might recall that this is not something that the board acts on. We talked a little bit about this last week, but the governor's office consults with us, and we use that survey data that we put out to all of our LEAs, and you might recall Jill's report to you, Jill Curry's report, with all the graphic representation of what our LEAs said that they would spend money on. That's a really great tool that we've been using to think about where we can fill the gaps and what the greatest needs are. So the governor's office used that data and then really looked at some of the focus areas of the governor, things that he's very passionate about, and have made a determination to focus their efforts on those LEAs that were, and students rather, within the LEAs that were most highly impacted by not receiving remote instruction. And we know that there were pockets, whether it's the digital divide or family circumstances, that they were just not able to engage. So really targeting funding to try and bridge that digital divide and make sure that kiddos get the help that they need. The last thing that I want to talk to you about would be advisory groups that I've been engaging with. So I put some teachers in a group, charter directors, principals, and superintendents, and basically just sending out a Google document with some questions and then meeting with them virtually a couple of times from now over the summer. And then on Friday, I'll be meeting with a broader council that includes parents and community partners. And the purpose is to help us think through policy and practices and guidance and really trying to find out what is helpful. This leads a little bit into an agenda item we're going to talk about shortly, and that is really defining roles. I know that Board Member Hanson made a motion, Board Member Earl and Board Member Lear and Davis were all very interested in this as well. So I'm excited about this conversation we're about to have on thinking about what is the board's role in guidance moving forward. But these advisory groups are small, and it's just a really great way to pose some questions and get their ideas, not only about what they experience, but what they need moving forward. Some of the big themes this morning in talking to teachers were things like teacher flexibility, needing definitions. So that teacher flexibility part may play into some policies and practices from us, maybe eliminating some policies or relieving some policies. And then also maybe some clear definitions about the differences between digital learning, homeschooling, remote learning, and maybe some ideas within that space so that everybody's using the same vocabulary, or that when everybody uses the same vocabulary, we know exactly what that means instead of having different descriptors about what it means. There was a great conversation about preserving in-person learning and how important that is to students and families and teachers and what that might look like going forward. So I just want you to know that those conversations that I'm having, they are the things that really energize me and give me a lot of information that I can then bring back to you as a board and move some conversations forward about your role and what you can do to support the needs out in the field. And I really appreciate the way that you're reaching out to all your constituents as well. Those of you that are on social media, I get to see it, but I know that everybody's doing so privately and having conversations. And that is really appreciated by the field, to know that the board is really listening to how this has impacted our teachers, our students, our school administrators, and our communities. So those are the 4 things that I wanted to share to you, or share with you rather. Are there any questions or comments?
Board member questions or comments? It appears Board Member Earl. Have your hand raised?
Yes, it is. Am I on now?
Yes, you are.
Okay. I just had a question on the ESSER's funding, and I don't know, Superintendent, if you have the answers or if someone does. I'm just wondering, so if I understand right, this was intended, the money was dispersed according to Title I funds in our state. And so I'm just wondering, are schools able to receive funds only according to the Title I students they have in their schools? Is that how we're distributing that?
So that's a great question. The actual total dollar amount that we got as a state was based on our Title I funding. I think it was about 70% of the overall funds. And then that's just dispersed throughout the schools, kind of on a per pupil basis. But if you were a school who didn't receive Title I funds for the last 2 years, we had one district and I think 22 charters. Deborah can correct me if she's on the phone, or Sarah. But those schools are not eligible, but they are eligible for our 10% set aside if we chose to use it in that manner, and gear funding. So while they don't get part of that 90% allocation, they would get, they would be eligible for other funds.
Okay, and is that's based on whether or not they apply for that funding, right? So they'll apply for it through a grant formula, and then that money will then be distributed to them. Do they have to? So I guess I haven't seen the grant paper, so I'm just wondering how a district goes about getting that. So I'm just asking the questions from this side.
Yeah, no, it's a great question. They were actually, oh, that is weird. It just sounded like there was an alien on the phone, sorry. So the amount that they received, that was already sent out in a spreadsheet. So the LEAs are aware of how much they are eligible for. And this is a reimbursement formula. So just like all the other title programs. So the amount for that school is loaded into the grants management system, and then they apply through the grants management system. And it's a reimbursement basis. So let's say their application has to be approved. So once that gets approved, then they use that Utah grants management system to get reimbursed. Deborah or Sarah, is there anything you would add to that so that we make sure we get board member Earl's question answered?
Deborah, are you on?
I think it's your microphone that's very strange.
Can you hear me? Can you hear me?
Somebody's got a Google mic on. Maybe turn your microphone on.
Can you hear me now?
Yes, Deborah.
Okay. I couldn't tell if I was on or off. So the bigger portion of the ESSER funds actually was distributed based on the Title I formula and how that went out. And yes, they do. It is in the grant system. They do apply for it, submit a plan for what they intend on spending the money for. And then, like Superintendent said, we've got the GEARS funding and the other 10% that will be distributed differently, which I don't know that we've got a decision made on the 10% yet, but it does go through the grant system based off of Title I funding. However, they can spend it on all students. Does that make sense? I don't know that I fully answered your question.
Board Member Earl, did you have a follow-up?
Yeah, I think that's closer. So let me just, if you don't mind me summarizing, just to make sure I understand that the money that was brought in, that districts or schools, LEAs, already have an understanding of how much they qualify for. They would then submit a grant to get the reimbursement for those funds. And then we have an amount that can be used for other schools and other capacities and however we need. Is that correct?
Yes, so we actually award the funds to them, and then they just submit basically a plan on how they intend on spending it, and then our grants managers will actually go in and approve those plans to make sure they fit within the parameters of the grant itself. And then, yes, we do. We have additional funding that we can then distribute in other ways, which will go out in a separate grant.
Thank you.
Does that help?
Yes. Okay, Board Member Cannon has a hand up.
Yes, I did. Thank you. I have a question for Deborah. She mentioned that all of this money that comes to us is based on the Title I formula. My question is, does the Title I formula still utilize per pupil expenditure as part of what the state gets? As I recall, previously, the per pupil spending, the more you spent on per pupil, the more you got. And of course, Utah was always, over the last 30 years has been spending the least per pupil. Is that still an aspect of the Title I formula? Or maybe she could just tell us exactly what that Title I formula is.
That's probably a question for Deborah.
Deborah?
That actually would be a question for Rebecca Donaldson. Actually, they're the ones that run the formula. And I don't think we've got anybody on, but I can find the answer and I can get it to you.
Superintendent Dixon, can you follow up on that? Make sure the board gets that formula.
Yes, it's a great question. We'll be happy to. In fact, I bet Rebecca's probably listening in and can type it to the board right now.
Okay. Any other questions for the superintendent? I am not seeing any other hands. Is that how you're seeing it, Vice Chair Cummins?
Yes.
Okay, Superintendent, thank you so much for your work on this. There is a lot going on. Next, we're going to move to our item number 5, which is USBE's reopening guidance. This is a discussion item. And from my understanding, what we've asked the Superintendent Dixon to do is to lay out where we're at on this, and then definitely get board member feedback. And if when doable, it won't require motions for any action or anything like that. But we're just trying to improve this guidance document. So you want to lay the framework of your presentation and your expectations, Superintendent, on this? I'll turn the time over to you.
Thank you. Thank you, Mr. Chair. I'd be happy to. I really appreciate the request that was made by board members last meeting where we talked about the role. I think this has been challenging for everyone. We have a lot of people weighing in on health and safety and the way forward. And I know that you've received a lot of inquiries about what it looks like in the fall and who makes that decision. And so I think this is a really important and timely conversation. So if I understand the request correctly, it really is to clarify roles, including the board's role when it comes to decisions reopening schools. So as Chair Huntsman mentioned, this isn't an action item, but certainly a worthy discussion item that could lead to action in the future. So I thought that maybe to try and get at this conversation that could be very unwieldy, that we would just ground it with some guidance. And so we sent you a draft guidance that we've been working on, not in any way that it's a directive, but just really as a reference and a backdrop that LEAs can use as they're making decisions about what to do moving forward. So there's that health piece, and then there's some instructional structure piece. So really, we just decided that there was a place for that, and we had a lot of people asking us for that. We sent it out so that you could give us feedback, and several of you did so. In fact, we've already incorporated some feedback that board member Lear gave to us that was really helpful, and you'll see this embedded right below the draft language that starts with each individual local school board or charter board. Governing board is responsible to determine what reopening will look like, and then there's some additional data on there. So that's something that we've incorporated. But before we come back to that, to make sure that's the kind of thing that you're comfortable with, we want to walk you through an exercise that hopefully can then ground you in helping to define and clarify roles. Thank you, Jeff, for driving these slides. So the first is just kind of helping us think about governance structure. And there are, as I mentioned earlier, there are a lot of people engaged in this work. So there's an executive decision-making group from the governor and the state health department. And if you see from this slide, you'll note that there are sections of code that determine this kind of guidance or oversight. And it really talks about who makes those decisions on opening or closing school. And it's based on disease prevalence and trying to mitigate the spread. So those are the things that the state health department and the group that the governor works with to try and make determinations about those color codes level of risk. So in that Utah Leads document, the very first one that was released was really trying to get out level of risk and what it meant for the communities. And people referred to them by color: red, orange, yellow or green as associated with a level of risk factor of community spread. So the board and even local health can weigh into that, but those decisions statewide come from an executive function. The next function is sort of this tactical or strategic function, and that's where our local health departments come into play. Although they consult in that executive space, they also really have a very prominent role in looking at businesses and community agencies and schools in their local jurisdiction, and they have legal authority as well by statute that you can see. So they have the ability to close schools, physical property, etc., based on any kind of disease. Okay, so then we have this third space that's more operational, and that's where we see our local education agencies, and perhaps the board may have a role as well. So the board might have a role in all three of these levels, but you can see from executive to local, there are statutory limitations and pieces of statute that give each one of these levels of government control about mitigating the impact to students and families. So I want to give you a couple of examples of where this might play out in the questions that you're getting and the things that we're trying to address. So the next slide is an example of, So this slide is an example thinking about hygiene. And this is one where if you look in the Utah Leads document, they have added to that with each iteration. And if you look at that executive function around the state health department, they've really weighed in on some guidelines, and maybe they might talk about hand hygiene in schools. In fact, they have. It's about washing of hands and hand sanitizer and a few other things. When you look at the strategic part, the local health departments then work very closely with their local schools and thinking about what are the best methods for doing that in a school. So the state might say, we expect you to have hand sanitizer, we expect you to have washing stations, but given the local context, what does that look like? And then from an operational standpoint, the school would say, the local health department has directed us to do such and such with hand hygiene. What does that mean in our school? What do we need? What do we have available? How will this work in the context of a school day? And then the implications of this is, do they have the funding to make changes? What will it mean in terms of learning time, et cetera? So that's just one way to think about the executive, tactical, and operational functions and where the board might have a role in talking about just something simple like hand hygiene. So the next slide, in example 2, let's talk about school schedules. So one was sort of that safe and healthy, or safety and hygiene. And the next is really the instructional structures, which people also want guidance on. So in the executive function, it might be distancing. Now, distancing certainly then impacts schedules. So are those, are they the same thing as for businesses, right? So they might give guidance on businesses, but then how do we interpret that for schools? So local health departments, knowing what a school looks like, would then help weigh in about that particular context. And then locals would have to really put in, they might have to change their schedules, et cetera, according to what the local health department says. So how will you modify those? I was looking at a survey, for example, that a charter school sent out. It was a great survey to parents. And they put forward the question that if we are in low risk, if we are in that yellow phase, what might that look like in our school? Here are some possible models and what would work for you and your family. I think they had about 180 responses. And it was really very interesting to see the variety of responses, taking into account the schedules of working parents, multiple children at home at various ages, all of those kinds of things. So really some great input from that particular community where they have to think about instructional structures if they have to accommodate distancing. So those are implications. Now, to the last slide then, excuse me. So given that context and those examples, how do you envision your role? So for example, in the executive space, it might be the board coordinating or consulting with the state health department on those implications for guidance for schools. So early on, when we started to see that guidance come out, and I made the inquiry about where are schools in all of this, are we supposed to interpret what has been given as guidance for businesses? Are we supposed to interpret that the same for schools? They really hadn't taken that into consideration. So really trying to figure out in consultation with the board, at what level does the state weigh in, and at what level do we give more specific guidance? In the tactical space, it might be facilitating consultations between health and education, maybe creating meetings or work groups, or providing guidance that they might need to think about in accordance with rules or policy, et cetera. And then moving into that operational space, thinking about what are the considerations that you might consider guidance, if you will, to help in planning. And then maybe there are some policy barriers that need to be addressed. When we talk about things like attendance and flexibility for teachers, you've already addressed a lot of those in the waivers that you created early on, but are there other considerations that we might provide to help them in planning? So those are some things to think about. And this is where I'll stop and just really encourage you to have conversation with each other and weigh in on what you think your role might be in those three arenas, sort of at a state or a local health level, and then the operational level of school of giving them guidance or looking at policy.
Okay. Thank you, Superintendent. I turned my screen off so I didn't have to compete against you and be a distraction on people's screens. So I turned mine back on here. This is the time for board members to ask questions or weigh in. So hands going up. Deborah Jacobson, I still see your hand up, but I don't think you're diving into this conversation. Board Member Lear.
Yes, I have a question for the superintendent. And I can't speak for all board members, but sometimes I feel like I am sort of reading about this and hearing about this in a vacuum. I'm not, I hear what my small community tells me and what emails I get. But my question for the superintendent is sort of to expand that to a larger audience is, do you think, from what you're hearing, do you feel like LEAs, the whole range of, and I know you can't speak to every single one, but are you generally comfortable and confident that of the 160-ish LEAs, that they understand that they are in charge of deciding when their school will open, how they're opening, what their opening will look like, notifying parents? Do they really understand that this is their responsibility, and that it could be different, significantly different from LEA to LEA?
That is a great question. I think that's the same question that I personally have had, Board Member Lear. I think it's something we need to clearly communicate, and along with that, pair that with making sure that they work with their local health department. That I think they're clear on. Working with local health department about safety and hygiene. I think they want, and again, this is just my assumption, but just based on what I hear, they definitely want flexibility and knowing their local context, but they also want some guidance of what it could look like. And so we're trying to push this notion that there are so many possibilities for you. It's something that you know your context best, you know students, parents. And so just like the example I gave you of the charter director who took the initiative to think about some possibilities and put that out to her community and get feedback, it's the very kind of thing we would expect of every LEA. So in sum, do I think that they're all aware that they have that flexibility and it's their role to do that? I'm not sure that they all feel confident in that. I think they probably know that they do, but their confidence level in reaching out and doing that and wanting to make sure that they don't cross any boundary or barrier that might be inappropriate. I think they just want to feel like they're in a safe space moving forward. And then there's a variety of opinions, as you stated, all over the place about what that should look like. So it's a hard, tricky space for, I think, our local leaders to navigate right now.
Can I just follow up briefly, Chair?
I figured you had a follow-up.
Well,
So just one
usually do.
follow-up because we'll have other conversations. So
I understand this is not long. Two pieces to this. First of all, I just think, and I've been feeling like a broken record saying this, I feel like anything we can do to say to every LEA, you are in charge of making this decision at the local level, at your level. I think the survey is a good indicator and a great idea. I asked this question because I was dismayed to open the newspaper this morning and say, all schools will be opening in the fall. And that's not what I had understood as a blanket statement. So it concerns me, and I grant you, the media has its own reasons and ways of doing things. So that's not it. That's certainly to take into consideration. But I just would really urge everyone at the state level, we're not the mouthpieces, that you make that so clear to LEAs. You are in charge of this. You have to make some decisions and take responsibility for this. And my second follow-up to that is, I think there, in this document, I see a lack of communicating that state money will continue to flow to LEAs who have this education continuity plan in place, that there's no stopping and starting of the funding. And I think that would be a good addition in some, I don't even know how to say it, but to make it clear that these LEAs are receiving state funding. Thanks for the indulgence.
okay, thank you. Did you have a follow-up to any of that, Superintendent?
I do. Thank you so much, Board Member Lear. Board Member Lear, just for the good of the group, gave us some really good feedback on the document about leading in with the very statement she just made about making sure LEAs know that they are to be in charge of the direction of their schools through their local boards. And I don't know, Board Member Lear, if you've had a chance to see that updated version, but that Tiffany Stanley sent to you. But I think that's, your point is great, that we really need to lead out right within that guidance document that they are in charge. And we'll make sure that the funding piece is clear in there as well. So that feedback was appreciated.
Thank you.
Hey, Superintendent, that this might help with a significant part of our discussion. When you were talking about they being the LEAs, the theys that I see in communication and what's happening out there, the they is superintendents, business administrators, charter school directors, and even some consultants out there that work with charter schools. But I'm not hearing very much in the they space local board presidents or local board members. And I understand with this, all the challenges that's going on with the fourth quarter, the last quarter of the school year, of having the schools shut down, and now we've got the financial challenges of what right looks like. I know that we have superintendent, well, all of our LEAs are submitting budgets on something that's not going to be real, which is the basic plus growth, and that. So there's a lot of challenges out there. But in the they space, in order for this to really stick on the they being the local control, and that local control has governing boards that need to be engaged in all of these conversations, more so with their local health department, because not all geographic areas are the same in the state. Not all schools are created equal and or with resources. So can you kind of maybe speak to part of the they, and then maybe what we might be able to do moving forward to make sure the people that are engaged are the people that are accountable, which are the local boards, because that's part of our recipe for success, where we're a lot different than a lot of other states, is these local boards have their responsibilities and accountabilities, and they've got to be at the table. So can you speak to that?
No, I think that's a really great observation. Our interaction as your staff are generally with superintendents, charter directors, principals, teachers in our various groups. And board to board is a little bit different space for staff, but certainly a space for you all. So to your point, sir, we do believe that it's key to make sure that our local charter boards and our local school boards are really engaged with that decision making. And it goes back to Board Member Lear's earlier comment about ensuring that people know their role and that they are in charge of this. I think Board Member Lear gave us some feedback about passive versus active roles. So anytime we can get clear about that, I'll give you an example. If you really heard what the governor said about schools opening in the fall, he said it is our intent for all schools to be open in the fall. When people have asked us, and I think this was in a formal statement we made as well from our office, that it is our role to support schools opening in the fall if they are able. So even those nuanced words about intent and support sometimes get left out. And then local boards feel left out. Like, what is our role? Who are making these decisions? So local boards have got to lean in with their local health departments and be connected. And I'm not sure the best way for us to keep pushing that forward other than to be exacting, precise, and more active in our language, that we include the role of the local board in things that we publish and that we say.
So just as a follow-up, and then I'll let others dive in, and apparently Board Member Scott Nielsen is trying to get online. So Miss Lorraine, can you shoot him a different phone number or something? He might be on a different number.
I can hear everybody. Can you hear me?
Oh, I've got you now. Okay, hang in there, Board Member Neil.
Okay.
Hey, thanks. Well, we couldn't hear you before. So is it?
Oh, yeah, must not have been it.
All right. Superintendent, is it something that we as board members can do with we talk about our constituents and that, and we do have our local boards that's within our voting district. Is that something that we could do on our end to reach out to them and invite them and remind them what we're looking for them to do, and then improve that, I guess, communication from them to us?
Yeah, I think that would be great, sir. And Jeff, if you could pull up the revised piece that had that language in there, let's go through that. And maybe this is a good third point or something concrete that the board can respond to. So if you will, I don't know if you all can see that. Maybe just make that even a little larger if you can, Jeff. For those of us over 50. Not that there are any board members over 50, but there might be a few.
There.
And then Board Member Scott Nelson, you're on deck. So
yeah, so
okay, perfect.
I think that will work. Thank you, Jeff. A little too big. Let's just leave it at that. I think we can get it. I just want to make sure that everybody can read it, and I'll read it aloud just for sake of people who are on by phone or not able to see the YouTube. So basically, this is after some decision points about the status of in-person instruction. It may be made in a number of ways. One, a statewide executive order or public health order may suspend in-person instruction, and then talks about that executive order. Two, local public health departments may issue a local health order suspending in-person instruction at a site or for an entire district. And then if that's not in place, so state, local, and then down to number three, a school district or charter school in collaboration with the local health department may decide to suspend in-person instruction due to the number of cases in the school or community. You might recall that one of the very first schools that was closed before the soft closure declared by the executive branch was a school where they had a full family infected with a couple of kiddos and parents. And the school worked directly with their health department to figure out the best course of action, and they did close their school doors. So this is the part I want to draw your attention to. Each individual local school board or charter school governing board is responsible to determine what reopening will look like in alignment with state and local public health directives. It is the authority of local boards to determine dates of reopening, what student schedules will look like, what bus routes will be available, if elementary students will continue with teachers from the 2020 school year, or if they will be assigned to new teachers and additional requirements for student attendance. USBE is committed to providing ongoing guidance and support and removing barriers to aid in this planning and transition. So the thinking behind this paragraph is to really play out, sir, what you and Board Member Lair were talking about, and that is to be very clear that it's the local board and charter governing boards who make these decisions. It uses the word board is, those boards, is responsible to determine what reopening will look like. And then that next paragraph, our role is to provide ongoing guidance and support and removing barriers to aid in this planning and transition. So that's where we're trying to, in writing at the beginning of this document, just be very clear about our role.
Okay.
Does that help?
Yes, thank you, Superintendent. Board Member Scott Nielsen, thanks for joining us. You're joining by phone. The way it works, so we're in a discussion. I think you know where we're at on the discussion item. So time is yours.
Okay, I really appreciate it. Carol, great topic, great question, because this has been a big concern. Also, thank you, Sid, so much. My biggest concern is, it's been my experience, and this is just everybody, regardless of the circumstance, is LEAs are so risk averse that at times they look to the state, they look for guidance from above. So what I would prefer is that we come out and say schools are open, unless your LEA deems otherwise, and that puts the ball in the LEA's court. Because I've had a lot of phone calls to us. What are you going to do about schools? Are schools going to open? Because the majority of people don't understand that their LEAs are the ones that are making these decisions. Because, with that decision-making power, they assume risk. And a lot of folks don't want to assume risk, especially local LEAs. So I would prefer that local LEAs understand, not just local LEAs, but the people understand, hey, schools are going to open. Your local LEAs are going to be making those decisions as far as what's going to happen with schedules and things like that. Because I still feel like that a lot of these LEAs are waiting for the state to tell them, yes, you're going to open, because they don't want to make a decision. That's all I'll say.
Okay, Superintendent, you want to respond? You have a comment to Board Member Nielsen's statement?
Yeah, I think you're all probably getting those same kinds of emails, and there's, again, just such a variety of perspectives about it. I want to draw you back to that executive function to make declarations statewide about opening and closing schools. That falls under the purview of the executive branch and local health departments. So when those two things, if you look back to the cascading effects, so the spring of 2020, just where you were, Jeff, was perfect. Well, you can leave it right there. That's fine, because that speaks to the sections of Utah code where this is outlined. So there are these varying functions. So I don't know that every local school can just say, well, we're going to choose to open or close. It's more about the structures within that. If the virus is such that if the state health department, was determined to be the one, then they would make that declaration. So I think that local weigh-in of the board and the school is really about, given that it's open in some form, whether we're at low risk in yellow or at green, what does that look like? And that's probably what you're saying, right, Nelson.
I understand ideas, and I understand that to a large extent. I just feel like that the vast majority of people, you and I and a lot of educators understand that it's the local LEAs and the health departments, but the vast majority of people don't. And so that's another thing I would like to, I would like everybody to understand that, so it doesn't fall on us, to where people understand, hey, it's a local decision based upon your local health department and your local school boards. So that's all I have to say. But anyways, thank you for reiterating and giving me that information.
Well, and this is a year of a lot of firsts. So over time, we'll probably be a lot better on our communications and that, but there are some challenges.
And I really appreciate Carol. I think Carol had some great points earlier. So thank you, Carol.
Board Member Bolter.
Thank you. So to Superintendent, I understand the structural where we've got the executive and then we have the local health department and then of course the operational. So my understanding is that when we are in yellow or green, then it falls under the local education agencies, the LEAs. Our guidance document that's been put together by staff only outlines guidance in the yellow phase. And I am wondering, what does green look like? Is green business as usual, going back to normal? Or is it a new normal? And then if it's the new normal, what do we mean by new normal?
Superintendent?
Yeah, that is an excellent question. We've been asked that question as well. And that's definitely in the local space. So when we talk about normal, we're talking about risk factors. As I've been meeting with teachers and principals and superintendents, there are definitely some things that they've learned through this experience that they want to do differently. And they definitely, even in that normal risk phase, they want to provide options for families, but trying to mitigate how to do that with their resources and their personnel. We are starting to revision and reimagine what even under normal circumstances it might look like. Are there more remote opportunities for students and families? One of the things we've definitely learned is how important communications with parents is. We've said that all along, but playing that out in reality has become even more important. So I think you'll see some relationships that will be strengthened. So Board Member Bolter, it's a great question. We get asked that all the time. We just see that really is local decisions about things that they've learned. And will it go back to the way it was before, or will there be some improvements that they want to make based on what they've learned?
Okay, so if we open and it's green, then it will be completely up to the local health departments what that will look like. We won't provide any type of guidance. This is just guidance in yellow.
Correct, yeah, and that's great clarification. And in that green space, I don't know that there would even be much interaction with local health departments, because if we're at normal risk, it just goes back to thinking about how you would normally run school. Now, I would anticipate that you would certainly see better hygiene practices in place. So kids would probably be more aware of washing hands. You would likely still see some hand sanitizer, some of those kinds of things. And then even making sure that we have thermometers in every school. So just trying to take the lessons learned and coupling those with what normal risk looks like. But our guidance and what people are asking for is, given that we're at low risk and we're supposed to mitigate all of these safe and healthy concerns, what does that look like? So that's where everybody's struggling a little bit, to your point.
Okay, thank you.
Board Member Davis.
Thank you. And thanks for all the work that has been done on this thus far. I can tell it's just been a lot of hours that have been put in. I agree with Board Member Lear to the extent that in any areas of flexibility that LEAs have, they should know that those are areas in their purview. But I'm a little bit concerned that we spread that message far and wide off the bat, because some things are not in their purview. And I don't want to give an illusion of freedom that isn't really there and have conflicting communications going on across the state. For example, an LEA or a district can choose to close a school in consultation with the health department, but if there's a certain number of cases and the health department closes the school cannot unilaterally open the school back up. And so additionally, I guess the question is, in these different colored phases, when the health department says these are the health that will take place in red, orange, yellow, and green, is it the law? Do LEAs have to follow those guidelines, or is it an optional recommendation? And if it's the law, I think we need to make that clear to LEAs. The next thing that I just want to point out is in a yellow phase under the coronavirus.gov guidebook, it says that the State Board of Education will give some leadership in two areas. One is face masks, and the other, one says details regarding face coverings will be provided by the State Board of Education in consultation with health department officials. And the second is more detailed operational guidance will be provided by the State Board of Education. As far as that more detailed guidance, I would love to see a very simple model policy provided in addition to all of these great documents that we have for resources and information. I would love to see a very simple graphic organizer that's a model policy similar to the one that is on the Box Elder Facebook page. And it's really easy for parents, teachers, administrators, anyone to read and understand. And it is just red phase. Here are the objectives. Here are the laws or whatever requirements from the health department. Here are some actions that could be taken in the schools. And then we could add on as a state board, here are instructional choices that could be considered by local departments. And here is the way the state board could help support in this area. Just a simple graphic organizer, straight across, red, orange, yellow, green. Would love to see something like that that's super user-friendly for people and is really clear. This is where the local boards have ownership and purview, and this is where they don't. And maybe I don't know that. Maybe I need to know. If the health department says in a yellow phase, A, B, C, and D, you are going to be in school, but you're going to be doing these things. Do schools have to do that, or is it completely optional? And maybe I need that clarification also.
Superintendent?
Yeah. Thank you so much, Board Member Davis. First, I want to speak to the face mask. That was corrected in the iteration of Utah Leads that just came out. And sometimes the website, because they're two different entities that work on that, sometimes the website's a bit of a lag. But that was corrected to not say the state board will be in consultation about face masks. I think we heard from you last time, that is very much a local decision. So that, I think the language now says local boards of education and local health departments in regards to face masks. Number two, thank you for referring back to the Box Elder. It is a really good tool and good look, but we have that data. So it's really about formatting it. And this guidance document that we're talking to you about today is the start of that, trying to get clear about roles and just putting this in front of you to say, is this the direction you want to go? And we can format it in any way, shape, or form.
You have a follow-up, Board Member Davis?
Yeah, just a quick follow-up. Thank you for clarifying that, and thank you for clarifying about the face masks. I know that there are some other states that are making statewide recommendations, like Kentucky, I think, just came out and said no masks in elementary schools. And I guess it would be interesting to watch and see what other states are doing, and if any leadership or guidance can be offered at the state level without harming those flexibilities that really are at the local levels.
Thank you. Board Member Hanson.
Thank you. I appreciate as well the work that's staff put in and the explanations that have been given so far. And I do think that we need to kind of stay in our lane as far as what responsibility we have. But I'm really uncomfortable with the LEAs get to decide everything approach. I think that we have a role to lead in the state as the state school board. And I see some of the guidance that's been put out by other states, Kentucky, Oregon, Maryland. There's others out there. I think Indiana produced a document. They're guidance documents, and I think that's in alignment with what the state's color code plan says when, the same section that Cindy just quoted, more detailed operational guidance will be provided by the State Board of Education. I think that's our role to help the LEAs along. I can see some LEAs functioning just fine under this, but other LEAs may be really floundering. There's a lot of stuff that needs to be taken care of and a lot of items that need to be checked off. I really see, it's too bad it's not on the backup information, but there was an Excel chart that was forwarded to me that I believe some of the staff members are working on that goes through each of the colors in the state's color code plan and talks about, it's mostly an instructional piece, I think, but talks about what schools may look like and what some options are for each of those. It's not fleshed out, but it does provide those headings that I think are important. I think that's a great format for us to work under, but I would like to see the two components of this, the health and safety component and then the instructional component. And for each of these phases, take each of the requirements that the state has given us and say, what does this look like in schools? And those requirements, it says here's K-12, and it also refers us back to, other things where we're an employer. We also basically run a restaurant with our cafeterias. We run large events like sports events. And so we fit into that space as well. And all those requirements, I think it would be beneficial to list those up and then say, what does this mean for schools? And then ask the question, how can USBE help? Because I think that's our role right now. To, in my mind, let the LEAs focus on instructional models, that sort of thing, and give them as much help as we can, particularly in the health and safety, and give them options that they can use. I do see other states weighing in that way. I'm not sure if their statutory scheme is that much different than ours. I'm not talking about mandates, but I am talking about approved options or recommended options. Also, I think that we can take a role in the procurement arena. If there are supplies and things that are needed, the large districts can probably get what they need. Smaller districts may have some trouble or may pay premium prices. I think that we can help there, like we do with educational software. We could also maybe cut some deals for some of the things that are required under this COVID arena, and let the schools participate with us or give them options to do that. Anyway, for me, I think that the USBE role is maybe more expanded than what Carol was talking about, and that we should take a leadership role and help these districts along. Give them good options that they can choose from. I'll comment later, maybe after I've heard some others talk.
Superintendent, do you want to respond?
Yes, I would love to. Thank you, Board Member Hanson. You are correct in that there is a table or a spreadsheet we're working on that is not quite ready for prime time yet, because we are doing just as you mentioned. We're getting feedback from the field about what do you need, just like I did with the group, the advisory group this morning of teachers, and getting a lot of input into some Google Docs I have. All of our staff are reaching out to see what kind of guidance is needed. So Jennifer Thronson is driving this instructional structure document that you're talking about. It just wasn't quite ready. So we are getting there in that instructional structure space. And the field has said to us, we would just like some starting points. We would like to know the possibilities and kind of define what that looks like. And then we can take it from there and make it work in our context. For the procurement piece, Board Member Hanson is absolutely spot on. We have been working on procurement. Zach Christensen, I know he met with state procurement today. Betty Sue Hinkson out of our office put a list of things together like thermometers, protective equipment, hand sanitizer, the things that we've been hearing from people that they are having a hard time getting. So you might recall that's one of the things we're thinking about with our 10% set aside. And I've been working personally on a project with masks for adults that may want them, and even families who may feel like some of their children need them as well. So we have some mask procurement. So a lot of things that we're looking at, and we hope to be able to bring that to you soon to let you know pricing and what we can get and some of the structures that we put in place to procure some statewide equipment. So that was something that I know Board Member Hanson and others expressed early on that we've been working on. I think what we can use help on as well is there, some of the executive orders, there are protocols that they may or may not relate to K-12 schools. So we do have some executive orders that we can lean on in terms of the state versus local. And that's already in place. And then there are some that aren't there. So I think Cindy Davis's description of the masks is a good one. Some states have weighed in on that and some have said it's local. So I think that gets back to what you would want to recommend that we get state guidance on or not. I would like to set up a meeting with state health officials, local officials, health officials, and some board members to maybe further that conversation where you could lead the conversation and really get clear about guidance. Like what do they, meaning the state health departments and local health departments, expect coming from them, and what as a board would you like to see? So I think that might be a good next step for you all to sit down together, and maybe a small committee of board members working with some local and state health representatives, so that we can see if there are gaps that need to be covered and who does that, who gives that direction. I will also say that talking to colleagues weekly, some of them gave guidance early on and even directives early on that a week or two later changes. So those that spent a lot of time and energy writing big documents, it changes. Just like our Utah Leads document, we're able to give input if we see that something more is needed from a state level, or if we want to change something like the face mask vernacular that was in there, putting that on the roll of the board. We can give that input and they respond. So I think that's important to know as well, that you always have a voice when you see something come out from a state level.
Thank you, Superintendent. You
Follow-up.
want to follow up?
Just
Hanson?
if I may, thank you.
You bet.
I appreciate the work on the procurement as well, and the time that Superintendent Dixon spent speaking with me. I think that as we go forward, and we're already seeing it, the state's going to be fragmented into kind of a quilt, a patchwork of different colors for different areas. But in my mind, schools operating under different colors should look fairly similar. So if schools are in the green phase, I think that their operations should be fairly close no matter where they are in the state. I think the schools that are operating in the orange or yellow should have the same basic things in place. We've got statewide guidance from the health department, so particularly the health and safety should look the same. Schools will have some choices, but that I think that we can weigh in and give them good options, I guess, to choose from in those areas. Also, I think that our check sheet, that our Excel chart, if we complete that correctly, could provide a good check sheet for the LEAs, just a list of things that they need to go through and make sure they have covered, because there are many, many things. And as we get into this, I think that will expand greatly, that need to be taken care of when we start thinking about protecting vulnerable teachers, students who opt to stay home because they're concerned about health risks, bouncing in and out of virtual and in-person school, many, many things, and many of our policies that probably need to be looked at. And maybe as we go through each of those criteria in detail, we'll be able to get a better handle on what our workload is and what the LEA's workload should be. Thank you.
And thank you. Board Member Marsh.
Thank you, Chair Huntsman. As I've been listening to the conversation today, a lot of it has stemmed to the fact of where our part is as a state board and the things that we do. I think we have to remember that we as a state board really believe local control and helping LEAs and charter directors run their schools in a way that fits the community and the vision of what their constituents want. I think we need to allow that to happen. We need to be more of a support group than we do a mandating body of things that should or shouldn't be done, because I think the state health department does a good job with that, giving them guidance as to what needs to take place to encourage, better health, better safety amongst our students that would be in the schools and employees. But I think one thing that we miss a lot of right there, and that is that our state superintendent, Superintendent Dixon, is a super leader for our state when it comes to meeting with superintendents of the districts and charter school, charter school directors. I know she personally has contact with each and every one of them all of the time. They're asking her for advice and for guidance as they go about their day-to-day business in their districts, and she does a wonderful job of that. I think we need to allow that to take place and allow them to do it, because having served on a local board, LEAs are very capable of doing what they need to do, and yes, they do need some assistance in ideas to craft and guide their district through what they're doing, and that's where our founding documents that we're putting together right now for support for these districts would come in and allow them to follow some of the ideas that we throw out there, what works for them, what might not. Take, for instance, if we happen to have a big storm coming in up here in northern Utah, and do we close schools? Do we leave them open? That's an individual district, and that depends on what's going on at that time in their district. What's their road crew able to do to keep the roads open? What's the safety? How far, how far are they traveling? And so as we allow them to do that, some open, some close. I've seen it along the Wasatch Front where large districts, some of them stayed open and some of them closed, and they're next door neighbors, but they handled it in their way. So I think that's something we have to remember. That is their spot and their lane that they run in is to make sure that their individual school in their area is guided and ran that way. And I believe that they can do it and they're willing to do so. But if we believe in local control, we need to allow them to do it and just be willing and ready to support. I know our staff does through academics and many other things, and I think they can do so with this one here. I think just keeping in contact with your state and local health departments. Summit County is where I live. Summit County is where some of my constituency is. And as many of you know, we've sat in orange for quite a while until the governor did an executive order and brought us out of orange down into yellow so that we all looked more alike. But at the same time, for whatever reasons, our local health department was holding us at an orange for a while longer than most and went to red, and that stayed there for a longer period of time than many of the other counties, whether that was our situation, our age demographics. It's up to them to give us some guidance on that, but ultimately our local control should still stay with our local boards, I believe. Thank you, Chair.
And thank you. Superintendent, do you have a comment or?
Well, I feel like I have to share appreciation I need to share appreciation for Board Member Marsh's kind words. Thank you. I do value the relationship that I have with our school leaders, including school boards. Earlier when I was talking about what our local schools are looking for in terms of safety, I think the right terminology is boundaries. And Board Member Marsh spoke to that well. it makes them feel safe if they know what the boundaries are. So I think that's the discussion really today. What are the boundaries set forth by state health, local health, Board of Education? So trying to create that framework and then they arrange the puzzle pieces therein, I think is really what I'm hearing from those leaders that Board Member Marsh referenced.
Thank you, Superintendent. Board Member Earl. Hands up.
Yes, thank you. Sorry.
And
Sorry.
and Board Member Marsh, your hands are still up. Maybe you want to get back in the queue. Go ahead. Sorry.
Okay. Just a couple things, just as we're talking here. I think there are some key things. We've already done it. We've already waded in, for example, on the grading. We didn't tell districts what they had to do, but provided some oversight or some guidance, and then allowed them to make those key decisions. And within that framework, they were easily able to work and say, okay, yes, we're moving in the right direction on this. So I think to wade into some of these things as far as guidance, like has been talked about by Scott, I think is completely appropriate. Just a couple of items. Sorry, we've gone through so many things that I'm trying to decide which ones to weigh in on. To say that we don't have an impact at that executive level, I think we do, because I think we have people that are representing us there. So if there's something that we need or that we desire, I think that conveying that to superintendent is exactly what we need to do, because either her or others are in on those meetings. They're there and they're available for that. And so I think as far as that executive level, we really do have some say there, and we do have say in what's going on. Just a couple of key things, I think, just as local entities need to understand, and the LEAs need to realize that they have the ability to choose those options and to make the necessary changes for themselves. I think somehow we need to convey to parents that they also have options, and to encourage LEAs to consider that, because some parents, no matter what color code we're in, will not feel comfortable sending their children next fall. For whatever reason, whether they have health issues going on in their own home or have an older population living at their home as well. So they're going to want to have those options on possibly an online learning scenario. And so I think districts, part of that guidance is from us, I see as creating online guidance as to things that work and things that don't work well. And I think that's a completely appropriate lane to wade into. Districts can either use it or not use it, but I think it provides leadership and a framework for them to build within. Let me just see what other quick notes I had here. There's just a lot of ambiguity, and I realize this is, as Chairman Huntsman had spoken of, these are first for everyone, right? And so we're moving into these areas of new and unknown, and it's that uncertainty. And so often when we use ambiguous language or lack of clarity, it speaks to the boundary dialogue we're carrying on. People aren't certain whether to move forward, and families especially are uncertain as to what the direction looks like moving into the fall, and they may start looking at a variety of options because they're uncertain as to where they want to go. Anyways, those are my comments. I believe we can create some guidance under certain scenarios. Some states have actually just, instead of saying this is what you need to do, which we don't want to do, they've just simply put questions out and said certain questions that, how are you going to address busing? How are you going to, so that it's nothing more than keeping in mind what are the key things so that they meet those key criteria and don't miss out on those. So that's my thoughts. I do have one question. So I'm guessing that the document, the opening paragraphs that were read were added to the guidance version, because I don't see that on my, in Civics Clerk. Is that in addition to what we've already received?
Superintendent, can you answer that question?
Yes, I can. Board Member Earl is correct. This is a first look at it today, and
Okay.
in response to Board Member Lear giving us feedback. So we wanted to make sure that it captured what she said, but we thought it was also really valuable for you all to see it because it does give more clarity with an active voice to the role of local boards. And it speaks to Chair Huntsman's concern about making sure that local boards really understand their role.
Okay, so if we have, is this meant to be a springboard, or is this meant to be some kind of something we talk about later down the road, vote on, or is this this document? Are we what are we going to use this for moving forward?
We'll continue to add to the draft. This is our guidance document that you're all talking about today. So the conversation is to help shape what should or shouldn't be in here. I loved, Board Member Earl, your comment about some states have developed a list of questions. New Jersey came out with a document recently that is called 91 Questions to Consider. And it's a great document. I read through the questions. There are things I certainly hadn't thought of. So sometimes it is just questions to consider when you're thinking about opening or just a lot of subtle things that are second, third level effects. So sometimes it is questions, sometimes it's guidance, sometimes it's making sure that we have the right guardrails in place. And this is our starting place for you to give feedback on.
And I might say again, it's a draft, and eventually, it seems like every week we get a little wiser and smarter, and not just the education community, but the health departments on what might offer in the future. But I just want to remind the board members that we have been engaged in giving guidance and helping with these LEAs in the last month and a half with extra board meetings. We've aggressively looked at what can we do to prop up public education and minimize risk and eliminate barriers during that last quarter of school. And so you as a board, with the help of our staff, of course, have we've changed rules. We've asked for that amendments to statutes, and our work isn't done, board members. We still have more work to do as we're rolling out into these uncertain times of what education is going to look like this fall. And so before us now, we have next week. I'm just looking at the calendar. We have next week board meeting. We have probably one additional board meeting. I don't think we'll have two. We don't have that second one on the calendar, but before the legislature meets. And so we have legislators that have just recently reached out to me saying they've already opened bill files. What can we do? And so we always ask ourselves, what more can we do for our LEAs? They're asking what more can they do for us? And amendments to statutes or changes and that. So we have been, you have been going about doing the work with the Board of Education in assisting these LEAs. So again, to eliminate barriers and help them with the risk side of compliance during the last part of the school year. And the expectation is that we still continue doing that into the next school year. So we are engaged. I just want to remind people that we've been engaged in a lot of the challenges that these LEAs are having, and will continue to be engaged moving forward. So there's a few other hands up.
Chair Huntsman, can I just add one thing to Board Member Earl's question?
Yes.
I do think it's important that we think of it sort of in the Utah Leads way, that at some point we need to get these drafts out and get input from the field as well. So this is a board document, it's a guidance document, and we think it's important that you really shape what this looks like. At the same time, we want to get input from the field as well. So if you're comfortable, I think we need to push this out and help them think about some of these things, but also give us input about what would be most valuable to board members at this point.
Do you want cereal or a sandwich?
No, I'm good on my sandwich.
Okay, I'll make a sandwich.
Oh, okay, we're taking food orders now. Superintendent, you want to finish or did you finish?
No, I've finished. I just, if anybody has strong feelings about us not having us push this out to the field yet, I think that people are waiting to see the kind of guidance that we're trying to get out there. So we would see this as just an iteration and an open and evolving document over time.
We haven't slowed you down from anything that's marked draft. And so we do like that feedback. Constantly asking for feedback from the field. Board Member Lear, your hand is up. I still see Board Member Davis's
Yes.
hands up also.
Yeah, I'll be short. You've been very patient with me. I'll be brief. I have just 2 questions. One's a yes or no question, and a recommendation. I fully support making this guidance available in public. It's not very meaningful if it's not. But my yes no question is this is one I've received from neighbors and family members. Is someone from assistance to LEAs as LEAs decide what to do with the transition students specifically? Those students entering kindergarten, those students moving from elementary to middle school, those students moving from middle school to high school. I would think that would be something that LEAs would appreciate. So yes or no is fine. If somebody's working on it, Jennifer Thronson, someone else, that's just what I'm asking.
Superintendent, on my end, the question was kind of broken up. Did you hear the question okay, and can you repeat it?
Yes, I think I got the gist of it. I think Board Member Earl's mic is open, and I think Sarah Young's was as well. So it cut out Board Member Lear's, but I think Board Member Lear, I heard you asking about transitions. Is somebody working on transition of K to 1, elementary to middle, middle to high? And the answer is yes. I know that that is a topic of concern for counselors. I met with 180 counselors. So they're working on that in their body, and superintendents have indicated that they're working on it, but we can certainly, I think that's in the instructional structures from Jennifer as well. So yes, we are working on it, and it's happening in a variety of places.
And the second part of my question, and this might be something that you could consider adding to the questions series. There's not much in the document that is specific to employees. And some of the emails I'm getting, there's apparently a form email out there that says open schools, no masks, school is normal, et cetera, et cetera. And I think, unfortunately, I think sometimes those show not much awareness of employees that would be affected in the schools. I'm just wondering if one of the questions couldn't both remind anyone who's reading this document that the employment issues are under the local LEAs, that are under LEAs completely, and that we also that the phases of the health department's concerns are also reflecting the employees that are with which schools could not operate. So I think maybe an employment question or section or something acknowledges that is a really serious concern of the changes that might take place in schools. That's all. Thank you. I don't need a response. I just if you'd consider adding that maybe to one of the questions. Thanks.
Board Member Lear didn't need a response, but Superintendent, did you want to respond?
No, I appreciate it. We definitely could address that, and we've been hearing from employees as well, teachers and others who are concerned about the workplace and the safety, their own safety in the workplace.
Board Member Davis, your hand is up.
Thank you. I had 2 things, but the first is a question. I appreciated Superintendent's comments about boundaries and completely agree. And it led me to remember that I don't think I processed fully the answer to my question, that when the state or local health departments list those items that are specific to K-12 schools and add the general population in red, orange, yellow, and green, are those by law recommendations or requirements? And then I have one more thing after the answer to that question.
Superintendent?
I think of a law as something that is in rule or code, and I see that as a guidance document. There are certainly pieces to health code. If it's violated, then health departments can take action, but it's my understanding that that is a guidance document. Now, Melissa or Tiffany or others may want to weigh in, perhaps had some other interactions, but that's how we have perceived those Utah Leads documents.
Okay, if we get different legal counsel on that, if you could just let us know, that's really good to know, actually. And then my other comment, I mean, I'm always think we should be getting input from the field. I also believe as soon as we send this out, even if it says draft, people are going to start thinking that this is it. So I don't know if we should send it out now or if we should put it out today on Civic Clerk for a meeting from a week from now and edit it as we get feedback, perhaps from your advisory groups, so the public can weigh in and then send it out once it's been an action item and voted upon. Either way, I'm really fine with it. I'm just throwing it out there as something else to consider.
Superintendent, did you want to follow up?
I actually have a question, and I'm sorry for answering a question with a question. It sort of leads me to wonder then, it's an action item or a vote. If this is sort of that living, breathing document that is guidance in nature, wondering how we shape an action item so that it continue to evolve without you having to take a vote every time is something added. And again, I don't know if that needs an answer, but it's just a question in my mind about the board giving an overall approval of the process, and then thinking about a process that's a little more streamlined so that you can continue to give input and help shape the document without us waiting month to month to come back and have a vote for it any time a change is made. So I'm just trying to think of that in my own mind about how that might work best.
So Superintendent, I have a note here. We'll certainly talk about it. I'll talk to Vice Chair Cummins on it in leadership. And then also in our next meeting is if this becomes an actionable item, and I think I can remember what board members were talking about it, is it loses its validity as a guidance document, and it creates a burden for LEAs as they assess the risk if they opt not to follow the guidance document. And so then that also prompts no action or very limited action. And so I think we need to weigh that out, and because it isn't an actionable item today, let's spend just a little bit of time on it between now and our next board meeting, and we might have another one right after that too, to see the unintended consequences of voting on this, and then restricting us as betterments move forward, and you can't add them to the list until we meet as a board and get consensus or a vote on. Vice Chair Cummins.
And may I just follow up on that, sir?
Go ahead.
So I appreciate that guidance. I think that will be really helpful to help shape what the action item might look like. I think another thing that we might need to sort out that maybe our AGs can help us with, it goes back to Board Member Davis's great question about, is this the rule of law? Is it guidance? Well, remember that the governor also gives executive orders, and some of those components of Utah Leads are in those executive orders. So for me, in my own mind, I think that's why it gets tricky to lean on some of these principles of guidance as legal document. So I don't really know where that executive order comes into play. So that's something that maybe our AGs could help with, or Angie with her vast policy knowledge. So we could bring that forward for next week as well.
Okay.
You bet, Superintendent. We can look into that.
Well, I won't reach out to Vice Chair Cummins unless you object to the direction we're going. Okay.
No, I don't.
Okay, thank you, Vice Chair Cummins. I'm looking at hands again. Board Member Earl, I haven't seen your hand come down yet, so are you still up?
I am still up.
All right.
Are you ready for me?
Yes, Board Member Earl.
Okay, I was going to say, and on mine, I don't have these numbered, but it's not the same that you've got there because you've added some, but so pages, according to mine, the reopening guidance version 1, I don't know, go down, right? I'm not sure if that's it. Anyways, it lists off principles and framework. I actually would suggest that there may be a different order to those, or a different items in general. I know these were taken from a variety of other sources. So before we go sending that out, would you just like me to send my thoughts on this, or what would you like, as this is kind of a living, breathing document? How do you want to handle that?
That would be great if you could just send them forward and send them to Tiffany and Jeff. Okay.
Because, correct me if I'm wrong, that's why I wasn't sure if this was just a springboard, or this was a done deal, so to speak, because I'd like us to weigh in on that more than just, taking someone else's items and using those, the assumptions and principles and that kind of a thing. So you're just saying send that in, or do we want dialogue about that in a board meeting?
Well, I think just like we, if I may, Mr. Chair, sorry.
Yeah. Go ahead.
I think a good example is Board Member Lear's commentary as we sent out the draft to use more active voice and make clear about the local board authority. So that was something we then put into the document that's not in civic, but putting before you today. So if there was information you wanted us to share, we could add that either as backup or send it out to the board for input, ready for another document to come forward to you to the next board meeting. So there are a variety of ways that we can do that, Board Member Earl.
Okay. There's just some components to this, even the reimagine. I know that's a kind of a catchphrase a lot of people are using. I feel like before we start reimagining things, I think we need to create safety and education that happens, collaboration, privacy, innovation before we start changing the way we do education completely. I think those dialogues come before something brand new. So I'll send out my items to you then.
Okay. All right, thank you. Board Member Hanson.
Sorry, I'll be brief. I just, the discussion we just had kind of raised a question with me as to if any board member weighs in on this, or if staff has a desire to put something in, does that just get added to the document and then go out to the public? Is that the process that we're going to follow? And who decides, who's the editor in chief for this?
Yeah, it's a great question. Just again, this is just thinking aloud here, but I would see that we send something out to the field and get input, and it's almost like having track changes in a Word doc, that we could actually put it in a Word doc and use track changes for the board, and then provide, much as Angie and her policy team do when they come to you with possible motions, like here are 3 motions that might address this, or 3 policy directions you could go. I imagine that we would do the same kind of thing, where we could say, here are 3 or 4 different ways to address this, or here are some ideas from board members. And then it's something we would send out to you and you could all look at for discussion at a following board meeting. And I think you bring up a good challenge, Board Member Hanson, because you might have a different idea than somebody else looking at the very same item. So keeping one document with some track changes for the board, I think would be helpful.
Okay, so if I understand correctly, what we're looking at today with Carol's comments in or with Carol's comments out will be version 1. And then we'll track changes until we adopt a version 2. Is that the way you see that going?
I think that adoption is the tricky part because, again, if it is a document that is iterative, so there will continue to be changes, then what is that formal adoption process? So that's something I feel like I need further conversation about, and whether leadership wants to take that up or you want to have some sort of formal process. I also feel like we as a board could use some direction and conversation with local and state health officials, as I mentioned earlier. And if you don't feel comfortable going there, I think that's fine. I continue to converse with them, but I would really like the board to personally be able to have conversations with those two entities, and that might inform this document as well.
I'd be happy to participate in that. And I understand then that we'll just track changes until we come up with a way to control the document from here on.
Unless somebody has a different idea, we're very open to that, sir. Just if somebody has a different way of doing it you think might be more effective and efficient, we're open.
No, sounds fine. Until we come up with another method, at least we'll know what's being changed and what we're doing going forward. Thank you. Appreciate the conversation today.
Sure.
I'm not seeing any other hands up. Are you seeing any, Vice Chair Cummins?
No.
Superintendent, thank you. Do you want to sum this up, or are we good?
No, I just really appreciate the dialogue today. We've done a lot of this, just trying to move forward and get something out to the field. And it's really important that if this is a board document, that you weigh in and have your voice in it. And so it's been very helpful. Just to summarize, if any of you have commentary, please send it to Jeff and Tiffany. We'll let you know who is the keeper of that document with track changes. I will set up a meeting with state and local health and a few board members. So I'll be circling back with leadership. If you are interested, please let leadership know, and we'll keep moving forward. Thanks so much. Really appreciate your input.
Thank you, Superintendent. Okay, board members, next item is item number 6 on the agenda, and it's an executive session. So before I seek a motion, Vice Chair Cummins or somebody want to explain what we're going to do again for those that might have forgot? We stay on the line, correct? And then we follow the instructions, but Vice Chair Cummins, maybe you're better off giving those instructions.
Correct. Jerry Record has already created a breakout room for us. And so we will all go in there. You'll either accept an invite or you'll just go automatically in there. And just remember to check your audio to get in. So if Jerry has anything else to add, that would be great.
Okay, so at this time, members, I'm seeking a motion that the board go into executive session for the purpose of discussing strategy or pending or reasonable imminent litigation.
So moved by Board Member Cannon.
Okay, we have a motion from Cannon. Is there a second?
I'll second that, Chair. Board Member Marsh.
This is a roll call vote. Board Member Belknap. Board Member Bolter.
Yes.
Board Member Cannon.
Yes.
Vice Chair Cummins.
Yes.
Board Member Davis. Board Member Davis. Board Member Earl.
Yes.
Board Member Gravitt.
Yes.
Board Member Hanson.
Yes.
Board Member Haynes,
Yes.
Board Member Lear,
Yes.
Board Member Marsh,
Yes.
Board Member Scott Nielsen, are you still on? I didn't know. I think he's dropped off. Board Member Newell,
Yes.
Board Member Thorpe,
Yes. Yes.
Board Member Huntsman's a yes. I'll go back to Board Member Davis.
Board Member Belknap, yes.
Board Member Belknap, okay. Board Member Davis, are you? This is a roll call vote. We have enough votes to go into the executive session, but just checking in on you. Okay, we're going into executive session. Jerry will. Okay, go ahead.
Chair Huntsman, I think we'll go now.
Okay, I'm seeking a motion to come out of executive session.
So moved.
That was,
Is that Laura Belknap?
okay. Do we have a second?
Board Member Thorpe, second.
Okay, we have a motion and a second. All please vote. We can use our checks. Okay, board members, we're still looking for a vote from board member Earl. Oh, did they all? Not showing. I'm showing the motion to come out of voting yes. I'm not sure if everybody's coming back online. What are you seeing, Vice Chair Cummins?
There's no vote from Board Member Thorpe, Board Member Davis, Board Member Newell, Board Member Marsh.
Could someone unmute Board Member Davis, please?
Remember, Davis, you're being picked on that meeting.
Seriously.
Hey, Board Member Marsh, are you showing a hand or a check? We have a motion to come out of executive session. Those in favor was Member Huntsman, Vice Chair Cummins, Member Earl, Member Hanson, Member Thorpe, Member Gravitt, Member Belknap, Member Lear, Member Cannon, Member Davis, Member Newell, Member Haynes, Member Bolter, Board Member Marsh. Are you on? Do you just want to give me a voice vote? We might have lost him in the trend.
No, yeah,
Oh, you there, Mark?
yes.
Yes. Okay. That's a unanimous vote to come out. Just for the record, we've got all our board members present except for Board Member Scott Nielsen, who participated with as part of the day. Motion passes. I'm not seeing any motions coming out of executive session. So board members, I want to thank you for your participation and input and contributions in today's meeting. A shout out to USBE staff for their preparation and all those that have participated, and looking forward to taking care of our board work next week, next Thursday, with committee meetings being Friday. Thanks again, and please take care and be safe. This meeting is adjourned.